Dr. Ken Redcross, author of Bond, The Four Cornerstones of a Lasting and Caring Relationship with Your Doctor, says doctors can be intimidating, but it doesn't have to be that way. You have a very unique practice in that you're a concierge physician. Talk about your practice.
Well, my practice is a little unique, everyone. Look, me as a concierge physician, think about when you go to a hotel and you're there with the concierge there. What do? They kind of direct you. Mm-hmm. They're kind of always there to answer questions whenever you need them when you come downstairs. And so that's kind of how my practice is. I provide 24/7 access for patients to be able to reach me. I make house calls. I even travel with some patients when it's possible. So, it's kind of a bespoke level of service that I really and truly feel, John, that, so many patients actually deserve.
Yeah. And in that unique practice, do you find it a little more difficult to have a long-lasting relationship with someone? They might see you one time just because they have an emergency, and then they may, go to another doctor or something like that. Or do you have long-lasting relationships?
Oh, no, guys. So it's just the opposite, John.
Okay.
With this level of service, I've had patients for years, some of them decades now, because when you have that level of care and service for someone, it's almost like they become a member of your family. Mm-hmm. And that's my goal there, so much so that my passion is the patient-doctor bond and relationship. And so that sort of relationship where you can kind of get to me when you need to, and we are able to have a nice discussion without being rushed. It really fosters this beautiful, what I like to always call a patient nirvana. When the patient's so happy that they're just like, oh my gosh, I can't believe that this is how medical care can be.
Well, you have a book out called The Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. What are those four cornerstones?
So look, everyone. I've been in practice for over 20 years now. So, time flies when you're having fun, as they say. Yeah. But let me tell you, I realized that there were four important things to make sure that we really had that perfect relationship. And it was trust, respect, empathy, and communication. And I recognized that if all of those were aligned, John, that it was a beautiful relationship. But if other patients were with doctors that some of those kind of pillars or cornerstones fell down, it didn't necessarily get to the finish line for that great relationship that I think every patient should have with their doctor. So if you think about those four things, trust, respect, empathy, and communication, if you think about those four things when you go to see your doctor, take a moment and see, are we kind of meeting the bar on each one of those? And if you are, I guarantee you have a good relationship with your doctor that you're very happy with.
Now, sometimes you go to see a doctor, and I hear sometimes how many patients doctors have to see in a day, and you don't have a lot of time with them. How can you maximize that?
Well, that's one of my challenges when I think about healthcare and where it's gone. So the practice that I have, John, it's a little different because I like to say it's based on value instead of volume. Mm-hmm. Because the typical healthcare system, you're absolutely right. When I was in that system myself, you were seeing 30 patients a day. Now it can be, 3 a week, depending on kind of what's going on for me. So, it's just important that when you're having this kind of new the way that healthcare is being delivered now, is that you recognize and realize that there is a better way to kind of do this. And so, it's important to have that discussion with your doctor and to figure out if some of this, the way that I practice, can kind of be done so that you get the time that you need.
You have three areas that you consider to be difficult discussions. I want to take them one by one because I've had experience in all three of them. So the first one, I recently actually had a conversation with my doctor about supplements. I'm not a supplement guy, but a friend of mine recommended a particular one, and I go see my doctor, and I said, is it okay that I'm taking this? And he goes, yeah, that's fine. It's perfect. I said, it's working. So how do you have those discussions about supplements?
Well, I'll tell you this, John. I'm glad you brought that up. And the reason why that's a difficult discussion, everyone, think about my career. So 20 years, I'm a Western trained physician. I trained here in Columbia, here in New York, Columbia Presbyterian. And so as I like to joke, I bleed Columbia blue. But I realized over time that there are alternative ways to heal. So I know you said you're not a supplement guy, John, but my goal in this talk and everybody listening is to make you a supplement guy. Because we do that, guys, to support what it is we're doing. And the supplement that we have to add is vitamin D. Know your vitamin D levels. And the reason why I say that, everyone, is that during this pandemic, there's one particular vitamin that's had a light kind of shown on it, and it's vitamin D. And it's because vitamin D is not only for bone health, vitamin D is really for our immune health. And so when we were hearing a lot during the pandemic, you saw that certain disease states were associated with vitamin D deficiency and worsening of the coronavirus, such as heart disease, lung disease, obesity, diabetes. Guess what, guys? They're all associated with vitamin D deficiency. So that's why I kind of jump up and down here, John, to say if there's any vitamin or any supplement that we all should be taking, or at least know our levels, it's vitamin D. Now, you can go to your doctor's office, John, or there are even cool websites like thepowerofd.org where you can order an at-home test kit. So in the comfort of your home, kind of concierge you what I do, you can know your levels. And so there's just important things to kind of know as you add that to what your doctor has you on too.
And to that, you mentioned COVID and, of course, the vaccine, and I realize it's a personal choice for everyone, but what are your thoughts on that, and what do you advise your patients?
So look, guys, I know, John, this can be a 5-hour show as we talk about vaccines, right?
You're right.
But I'll condense it because, look, everyone, like John, you just mentioned, well put, it's kind of a personal decision. Obviously, look, I have some patients who have several comorbid illnesses, African-American background. There were increased risk during this time. That's a different discussion that I need to have to say, look, this vaccine is something that you really need to consider. But is that the same discussion that I have with my, 16-year-old, friends of my twins and that sort of thing? No, it's a different discussion. So it's very personal, but it's a difficult discussion you need to have. So you need to go to your doctor, have that discussion. But once again, just come in open-minded. Ask your doctor the things like, hey, doc, what are the pros and cons of me taking it? Me is the important thing. Why do you think I need to take it? And so that tends to make this kind of discussion a smidgen easier so that you realize that we're all in this boat together and, one size doesn't really fit all.
Yeah. Something else that will affect just about everybody listening to this show, and that is coming clean with your doctor. You ask your question, and you go, "Well, I don't do that."
Right.
But then in your head, you're like, "I just completely lied to them."
Absolutely. That's why I look you dead in the eye, John. When I talk to patients, I always joke. I say, "I'm looking you right in the whites of your eyes."
Yeah.
Look, coming clean is important, everyone, and I realize and recognize that sometimes it's embarrassing. Sometimes, especially during the pandemic, John, I've had patients to where I have to talk to them when they're like, doc, I think I've been drinking a little too much. And, I'm a little more stressed and I feel more isolated than I ever have. And those are difficult discussions to have with your doctor, especially if you don't have that good relationship. So everyone, please come clean, because if we don't know, your doctor, your professional, we don't know how to help. And, with, once again, the way the healthcare system is, it's kind of rushed at times. And so we have to hit the pause button, come clean, and let them know, hey, doc, I need a little bit more of your time.
Now, can you tell when somebody's not telling you the truth? And
it's funny. I tend to fancy myself pretty good with body language.
Yeah.
I wrote a little bit about that in my book, because I will look at eyes that are kind of darting to the left or to the right, John, or some squirming or moving around and that sort of, and I'll circle back and ask the question again and see if I get the same answer. So I think I do a pretty decent job at that, but I'm sure somebody sneaks by me here and there, but I hope to catch them the next visit.
Yeah, I'm trying to get better about that myself. It's funny. It's funny though. You may notice this. But sometimes if some of my doctors, they're more stoic, and you don't feel as comfortable, and then you have my regular doctor I've been going to 15 years, so they know everything. Yeah. But the personality, and you have a great personality, so I would open up to you. So.
Oh, well, I appreciate that. I think it's the only child talker in me, John. Yeah. I'll talk to a wall if you let me.
Yeah.
So I think that definitely it helps. And one other thing I should mention too, everyone, and I kind of call this medical visit 101, because once again, I didn't even mention, John, but on average in the United States, where you're up to about 7.5 minutes with your doctor during your visit.
Yeah.
Obviously unacceptable to get, everything that needs to be done. So I usually say there's 3 important things that I want everyone listening to do. Number 1, before you see your doctor, John, make a list. You'd be surprised. You go in there, you have a problem and an issue, you think you're going to remember, but if you make that list, you're going to have a list of 3 or 4 things, because you remember 3 or 4 months ago, like, gosh, I meant to ask the doctor about that. And so that's an important thing too. The
Yeah.
second thing I'll mention, John, is to repeat information when you're there. They did this study, John, which I always quote because I found it fascinating. But they were saying that when you go and you come in and see your doctor, when you leave, you only remember about 20% of what we discussed. And of that 20%, John, guess what? Half of it is wrong. And so that's why I find that improves when you repeat it over and over again so that you're on the same page. And last but not least, ask questions. As you always remember when we were in elementary school, your teacher would always say, there's no such thing as a stupid question. And it's true.
Yeah.
So you want to make sure you ask your doctor your question, make sure you come in and you're engaged in this visit. So I just wanted to throw those three things out so that people can kind of strategize a bit before they come in and see the doc.
Well, your book is called Bond, The Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. Where's the book available, and where can listeners find out more about the work you do and the things you've talked about today?
Oh, absolutely, guys. So look, the book is available on Amazon. Once again, it's called Bond, The Four Cornerstones of a Lasting and Caring Relationship with Your Doctor, which is my passion and very important. You can reach me on any social media platform, Dr. Ken Redcross. Yes, just like the American Red Cross. And you can find me on Facebook, Twitter, Instagram, my website, drkenredcross.com. So you can find me anywhere. So please reach out, say hello, and let me know how your interactions have been with the doctor as well. And know your vitamin D levels, please. You too, John.
You got me thinking now. I might be a supplement guy soon.
Good.
Well, look, I've got one so far, and it's working great.
All right. I'd love to hear it.
That's Dr. Ken Redcross. He is the author of a book called Bond, The Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. He is also the founder of Redcross Concierge, a personalized medical practice designed to enhance the patient-doctor relationship while providing convenient access to a full spectrum of healthcare services and holistic and wellness counseling.